Hi everybody, welcome back.
Hi everybody,
to
welcome back.
My name is
Educated
Erin.
Nurse. My name is Erin. I'm the owner.
I just want to welcome you back to the EKG series.
We
covered normal sinus rhythm last week, and now we're going to add in sinus bradycardia and sinus tachycardia. If you're new to us, you can follow us on Facebook and Instagram, and then we also have a shop on Etsy and Shopify, which you can find in our links on YouTube, where we sell study guides, merchandise, and templates for EMT, paramedic, and nursing. So let's dive into EKGs. Let's start with a review of normal sinus rhythm. To have normal sinus rhythm, there are 10 criteria that you have to meet in order for it to be normal. The first one is the rate. A normal heart rate should be between 60 and 100. In this particular rhythm, you can see that there are 7 P waves and 7 QRS complexes. Knowing that this is a 6-second strip, we're going to multiply 7 times 10, which is going to give us our rate for 1 minute. So in this case, the heart rate is 70. When you look at rate and regularity and rhythm, you'll see in the first video on normal sinus rhythm, I'll explain how to march that out. In this particular rhythm, for normal sinus rhythm, your rate and regularity should be regular. The P to P and the QRS to QRS should march out in a regular fashion. If it doesn't, it's abnormal somehow. It's irregular for the rate and rhythm. Okay? Then the P wave. The P wave, you should have 1 before every QRS. The P wave should not be longer than 0.12 seconds, or 3 little boxes. The PR interval, measuring from the P to the start of the QRS, actually it's a PQ interval, that should not be longer than 0.20 seconds, and then the QRS should not be more than 0.12 seconds. And again, there should be a P wave before every QRS. And all of those measurements should be normal. Then you want to look at the ST segment. The ST segment should be flat at baseline. There should not be any elevation or depression. You will see a T wave. That's normal. You will always have a T wave. You might not always have a P wave. You may or may not see a U wave. Typically, we're going to see a U wave when a patient has low potassium. And then there should not be any early beats, and there should not be any late beats. So if you meet all of those 10 criteria, you probably have normal sinus rhythm. All right, so let's look at some alterations. The first rhythm we're going to look at is sinus bradycardia. Remember, we just talked about the 10 points to normal sinus bradycardia. Everything is going to be normal. Everything is going to be normal except the rate. And so rhythm and regularity is going to be march out at an appropriate time, and it's going to be evenly spaced, and the rate is going to be regular. The rate is going to be regular. The rhythm is going to be regular. The rhythm is going to be regular. There's going to be a P wave. There's going to be a P wave. The measurement is going to be normal. There's going to be a QRS. There's going to be a P wave before every QRS complex. The measurement is going to be normal. The measurement is going to be normal. The PR interval measurement is going to be normal. You will have your ST segment. There will be a T wave. There will be a T wave. And there will be no early beats. And there will be no early beats and no late beats. Everything about sinus bradycardia is the same as normal sinus rhythm. The heart rate. In this particular instance, you can see on the EKG, there are 5 P waves and 5 QRSs. Knowing this is a 6-second strip, we're going to multiply 5 by 10 to get our rate or beats per minute, which is 50. So in sinus bradycardia, everything is normal except the rate will be below 60. So what causes sinus bradycardia? Well, there's a lot of causes, and in a healthy heart and a healthy adult, it could be normal to be in bradycardia. We see this a lot in our athletes that are highly conditioned, so it's not uncommon to see their heart rate below 60, and that's okay. Most of the time, patients are going to be asymptomatic. It can also happen if you're hypothermic, if you're doing some vagal stimulation, that can slow down the heart rate. If you're doing any sort of carotid massage, if you're on cardiac medications like a beta blocker or a calcium channel blocker, your heart rate could be low or below 60. And again, if the patient is not symptomatic, we don't really care. And I'm not saying that meanly, it's just we don't really worry about it because that's what the medications are intended to do. You might also see this in a heart attack. and when patients have cerebral swelling due to increased intracranial pressure. Symptoms for bradycardia, again, the patient might be completely asymptomatic. They might have cool, clammy skin, pale skin, and that's just due to a lack of cardiac output and circulation because the heart is beating slower than it should. You might see hypotension, weakness, neurological changes, and again, the first stop on the oxygen train is the brain. So if the heart rate is slowed down, the brain's not getting as much oxygen as it should. You also might see some shortness of breath, and again, due to decreased cardiac output, less blood circulating. In terms of bradycardia treatment, if the patient is asymptomatic and they're healthy, like your marathon runner, we're not going to do anything. Now, if they are symptomatic and not feeling well, always support their ABCs, supply some oxygen if you need to, start an IV, give them some fluids. Atropine is a medication that we can give to increase heart rate. And if someone's really bradycardic and really symptomatic, they might consider doing an implantable, either temporary or permanent pacemaker. Okay, the next rhythm we're going to look at is sinus tachycardia. Just like with bradycardia, in tachycardia, sinus tachycardia, everything is normal. It's normal except the rate. We said that in a normal sinus rhythm rate, the rate is 60 to 100. In sinus tachycardia, all the measurements, there's going to be no early beats, no late beats. That ST segment is going to be at baseline. The P, the PR interval, and the QRS are all going to be normal. The only thing that's going to be abnormal is the rate. The rate is going to be greater than 100. Everything else, as you can see in our 10 points to normal sinus rhythm, are going to be normal, except the rate. The rate will be greater than 100. Okay, let's talk sinus tachycardia. So sinus tachycardia, what could be the cause? A lot of causes for sinus tachycardia. If I go run down the street right now, I will be in sinus tachycardia. We see this a lot in our patients, whether they're anxious, whether they're scared or nervous, even just to be in the hospital, or the clinic, or just to be around a doctor. We can see it in patients that are stressed, patients that are exercising, that have infection, or even a fever, or even a fever can elevate your heart rate. If patients are in pain, that's going to increase our vital signs. Hypotension, and hypovolemia, so somebody's dehydrated, the heart rate can try and compensate by increasing the heart rate to deal with the low blood pressure. They're kind of opposite. Okay. If a patient is anemic, or if they've had a heart attack, if someone is really short of breath and they're not getting the oxygen that they need, the heart rate is going to try and go up, and the heart is going to try and beat faster to get more oxygen to where it needs to go. We talked in the last slide about sinus bradycardia treatments, and atropine was a treatment. Atropine can cause tachycardia once it starts working where they get too much. Other medications such as vasopressor medications like epinephrine and norepinephrine can increase heart rate. Other things like over-the-counter medications like Sudafed, which got pseudoephedrine, and then stimulant drugs like amphetamine and methamphetamine can also cause. So if you see that in like a young person, that would be certainly a cause. Symptoms of sinus tachycardia, the patient might be asymptomatic. You might notice that they're pale and cool. You might notice that their blood pressure is going to be higher or low. You will notice neuro changes again. The first stop on the oxygen train is the brain. And they might be short of breath. Again, with sinus tachycardia, you might not need to treat it. If the patient is asymptomatic, you might not need to treat it, especially if they have adequate perfusion. If they have an infection, or they have a fever, or they are dehydrated, treat the underlying cause. If you do that, you'll probably treat your tachycardia. If not, support their ABCs, give them oxygen, give them fluids. You can try vagal maneuvers where they bear down, and sometimes that will stimulate and lower the heart rate. Adenosine is an option, but the patient has to meet certain criteria to use that medication, and we'll talk about that in another podcast here. Cardiac medications like beta blockers or calcium channel blockers can certainly bring down the heart rate and are often used. Most of them are given IV just so they work quickly. And if there's a wide complex tachycardia, amiodarone could be given too, and they can consider cardioversion. So it really depends on what the underlying condition is. If the patient is getting adequate perfusion, if the patient is symptomatic, that will help you guide treatment. But most of the time, if you correct the underlying cause, you'll correct the problem with sinus tachycardia. All right, thanks for watching our quick video on sinus bradycardia and sinus Again, if you're new to us, you can follow us on Facebook, Instagram. You can like and subscribe to our YouTube channel, where there's going to be tons more videos in the next few weeks as I get up and running here. If you're looking for more information on EKG, I also have a study guide that's over 50 pages long with practice EKG strips and practice NCLEX style in the study guide, which you can find in our Shopify. And if you have any questions, don't hesitate to reach out, and I'll catch you next time in the next video. Bye.